So in this video I'm going to just go quickly over the, let's say, like breathing reeducation when I have a client who is not able to take abdominal breathing or is struggling with the intra-abdominal pressure or with the 360 breathing, some kind of very simple cue, something what I found helpful. This is usually a very nice first step, how to get somebody who is kind of very stressed, in a lot of pain, somebody who has a lot of discomfort, let's say in the lower back or the neck, or somebody who spends a long time sitting, just to be able to relax, maybe take a few breaths. Initially my recommendation would be don't try to do it don't try to be like that all day. Maybe set a timer every 30 minutes or every hour, and maybe like take a few breaths and just practice it regularly. What I usually recommend is do this for a short time and very often, because like with the new skill, oftentimes the repetition is the king. So rather than trying to spend, let's say, like 30 minutes trying to learn how to breathe, it's good to kind of do it and revisit this option very often. And again, it's just an option how to breathe. With the breathing, there is usually not right or wrong. We have certain breathing styles have certain benefits, and the benefit with this is it's going to help to relax certain muscles. It's going to help you then to follow up with some kind of core conditioning, with some neck relaxation exercises, which I find usually very helpful for the client. Initially, what you can do is, just for a little bit of awareness, you're just going to put the one palm on your chest and one on your tummy. You're going to take a nice deep breath into your chest. You should see this arm raising, and then you're going to breathe out, and you can repeat it like 2 or 3 times. Next one, you're going to, while breathe, kind of keeping that hand down, breathing out, you will try to breathe into this hand. And what you should find is this hand starts to move first, and then there is going to be a little bit of movement of this arm. At no point you should feel like the shoulders are raising. But again, if you are learning, just be patient with yourself. It's going to take a little bit of time. After, let's say, mastering of this, what you're going to then do is just switch the hands, almost like it's a pinch grip, I guess. What you're going to do is just put your hands into your tummy, and the next hand is going to go on almost like in those pockets in the lower back. And again, just try to relax the shoulders and try to breathe into the fingers. And just breathing out. If you are able to do this, congratulations, because it's usually take a little bit of time. The next step would be just to be able to breathe into those fingers, hold a little bit of pressure and breathe out. So you kind of try to train yourself to be able to maintain a little bit of intra-abdominal pressure without independent of your breathing. This is going to be very helpful because a lot of time, let's say athletes or even people who are sitting, we need to oftentimes choose between are we breathing or are we stabilizing. In my opinion, we should be able to create a little bit of intra-abdominal pressure and keep the breathing while we are also able to maintain that pressure, so a little bit of stabilizing. What that's going to do, it's going to help us to open up the thoracic spine, upper back. It's going to help to spread the stabilization or the, let's say, the core stability from just the outside muscles to almost like if you imagine pressurized beer can, you cannot squish it, you cannot turn it. And when you empty the can, you are able to squeeze it, rotate it every so often. Another advantage is, let's say when you are looking to me from the side, here is your lower back. If you are able to maintain a little bit of pressure over there, or when you are lifting or deadlifting or bending, quite a lot of pressure, you're going to change the fulcrum of your lower back. So let's say if there would be no pressure, your lower back would be almost like your vertebrae would be doing this. Almost like the center of the rotation would be very close to the spine. And when you are able to create and maintain that intra-abdominal pressure, then a lot is going to be more like almost like around it. So you'll be doing this rather than just hinging very specifically in one segment. And there is like a little bit of theory, or that's kind of my opinion, that might help you to buffer the flexion of the back when you are able to maintain that intra-abdominal pressure and protect it, kind of spread the load in between the vertebrae, in between your hamstrings, between your hips, your thoracic spine. Not to put all of that stress just a bit in between one vertebra. But end of the rant, hopefully this was helpful. Again, bottom line is practice short and often, be patient, don't get discouraged, and try to relax into it. This technique is more kind of a little bit about the relaxation rather than about I'm just going to do it. So I guess Zen-like state. Guys, good luck. Hopefully this was helpful.